I decided to become a doctor because when I was younger, I used to be very inquisitive and ask a lot of questions, which honestly probably annoyed my sisters at the time. But I always wanted to know, I pretty much wanted to know a little bit about everything. And once I found out that doctors, their job was to actually answer people's questions about just about anything, especially as it pertains to their health, I said, oh, I definitely want to be that. I want to be a doctor. I want to be that individual that has a lot of answers to a lot of people's questions. So that's why I wanted to be a doctor. My specialty is internal medicine. A lot of times people don't know what that is exactly. So I tell them that it's basically how a pediatrician is for children, an internal medicine doctor is for adults. So I'm a primary care provider that works with adults. We oftentimes take care of patients with a lot of different health issues and comorbidities, and we bring in that big picture of all the different problems that a patient might have together to make them the healthiest patient that we can. So that's what internal medicine is, and that's what I do for a living. What do I love about being a doctor? What do I not love about being a doctor? So one of my favorite things about being a doctor is every day I get to go into the office and teach people about their health. I think one of the most important things about being healthy or maintaining your health, especially as you get older, is knowing why you have the certain conditions that you have. One of the things I like the most, or I find the most invigorating or rewarding, is you'll have this patient that comes into the office and they have diabetes, it's really poorly controlled, and then you teach them about it. You teach them how they got it, what they can do to fix it, what they can do to kind of keep it, I guess, at bay. And then 6 months later, they come into the office and they're telling you what their hemoglobin A1C is and how they've changed their diet and changed their exercise and they're feeling great. So that's a really rewarding experience for me, specifically as it pertains to internal medicine and being a doctor. So besides being a physician, I love gardening. So unfortunately, I live in the city. I live in DC now, and I don't necessarily have a yard to do any gardening. But to offset that, I often will do like flower arrangements around the house. I have a couple of vases that I like to fill with flowers every now and again, and it allows me to be creative. I think my job allows me to be creative as well, but this is a different type of creativity that I don't often get to do as much. And meanwhile, while I don't have a garden to actually garden, I'm able to do some floral arrangements. I plan on getting some more plants in my office to have plants and take care of them as well, and watering them and watching them grow, and whatever challenges come with that. So gardening overall and I guess playing with flowers is something that I like to do for fun. So oftentimes patients will get really bogged down about, man, I gotta get my blood sugar together. Oh, my blood pressure is so high. And they get into these ruts of, I have to completely take this out of my diet, or I have to start doing this every single day. And I don't agree with that. I think that, just doing everything in moderation. If you have a problem with eating sweets, I never say take all sweets out of your diet. Just limit it to 1 or 2 times a week and just kind of see how that goes. Because oftentimes when people have issues with eating too many sweets, it's like the 5 or 6 days that they're eating mounds and mounds of sweets. But if you decrease it to like 1 or 2 days out the week, which we can call your quote unquote cheat days, it can be really helpful, and you can find in the long run, it actually helps your health a lot better and your mental health. You're allowed to do things that you like. You're allowed to kind of have those cheat days, and I think it helps keep you mentally healthy as well as physically healthy.